I think it's going to have a devastating impact for a lot of people in our community.
State and county leaders are scrambling to come up with a plan to handle the billions of dollars in federal funding that has been cut in the spending bill and tax mega bill passed last week in Washington, D.C. As News 10 NBC investigative reporter Jennifer Lukey shows us, Assembly Democrats are meeting tomorrow to decide the best path forward.
Congressman Joe Morelli has made his position on the bill clear.
I'll be supporting court challenges to it, calling for oversight in congressional hearings and meetings, and making sure the voice of the people in this community is heard and heard loudly.
But not all voices are the same.
I think there will be an impact, but I don't know if it's to the same level that what we've heard since the bill passed on the 4th of July.
The two big programs that are of concern are Medicaid and SNAP.
If you think about it, taking away Medicaid coverage from an individual doesn't stop that person from being sick. They're still going to get sick. A person who's uninsured is still going to show up at a hospital seeking treatment, and they're still going to be treated, and somebody still has to pay for that. And so that cost is now going to be redistributed.
In order to receive Medicaid, able-bodied childless adults between the ages of 18 and 64 will now have to prove that they're either working, in school, or doing community service for 80 hours a month. The concern is the paperwork and deadlines could be burdensome for people to either prove they meet that requirement or that they should be exempt. Since New York has one of the highest Medicaid populations in the country, we're bound to feel it more. Plus, the state budget director says the feds are shifting administration costs to states too, which in New York is at least a $750 million cost he wasn't expecting.
I think we should look at our rainy day fund, which has $8.1 billion in reserves. We have an economic uncertainty fund of $3.3 billion. I would say that especially for our hospitals, especially in Monroe County, that are huge economic drivers, that would be a good way to leverage some of that money.
Meantime, much of what happens at the county level will largely depend on what the state response is.
Where can efficiencies be drawn within the system? Where can agencies work together to try to fill gaps that exist? And then where are there gaps that we simply just don't have funding for? And then what's the next advocacy step, and where do we go to try to fill those gaps?
So tomorrow, Democrats in the state assembly who hold the majority will convene for a meeting to determine what's next, how to proceed. It's possible, Nikki, that all state lawmakers will get called back to Albany in the next couple of months for a special session to vote, because the money's going to have to come from somewhere and they're going to have to decide where. And we've been getting so many emails and calls into our newsroom from people either on Medicaid or they get SNAP benefits, and they want to know what this means for them. So what do they need to know? Well, right now, my advice is don't panic. Really, at this point, those who are disabled or who are unable to work should be able to keep whatever benefits they have currently for the foreseeable future. The work requirements are set to begin in late 2026, so there's still some time.
Wow, okay.
And then the full changes with Medicaid, those start to be funneled in 2028. So there is some time here for the state and the county to smooth things out, see what's going to work and what's not.
All right, we'll be tracking it every step of the way.
For sure.
Thank you, Jen.